This is Health Jump, and today we're here with Garrett Schmidt, the CEO of Value-Based Care Exhibit Hall. Garrett, thank you so much for taking some time.
Thanks for having me.
So tell me, what is a Value-Based Care Exhibit Hall?
What we are doing is trying to provide the best resources and solutions to the ACO and value-based care community. Actually, we came from a consulting background, and we found working with ACOs that they had a lot of needs beyond what we could provide simply through consulting. So what we wanted to try to do is compile all the best solutions in the market and be able to provide a short list of vetted solutions to the ACO world. So after several iterations, we are now the VBC Exhibit Hall.com and continuing to grow all the time. Early on when we were doing this, we put out a request or a call to be kind of a steering committee that we could bounce ideas off of. And we thought there would just be crickets when we put that out. But actually there was an outpouring of support. And a lot of ACO executives from around the country wanted to be part of this, even though it was a voluntary thing. And the reason, as we were talking to them individually, is we found out that there is a common desire for good solutions in the marketplace. It is saturated with a lot of overnight startups, which isn't a bad thing. We were an overnight startup at different times, and so I'm not slamming that at all. However, there can be a lot of noise, and these leaders are looking to us and trying to help us in our mission of providing the best solutions in an organized fashion. So a lot of the challenges and a lot of the things that are faced by these different individuals are coming from a lot of different places. Not only that, you have a lot of different structures, whether it's physician run, whether it's hospital led, whether they're huge health systems or teaching hospitals. They all look different. So what we wanted to try to do and to accomplish is to pull together a myriad of different experiences and perspectives that are in the C-suite. So most of these folks, you'll notice, are in the C-suite or are currently consultants to the C-suite for ACOs all around the country.
So you said there's a broad perspective from physician-led all the way to hospitals and all of these larger groups. Are there any common challenges that they're all wrestling with together?
Yeah, there's a few that come to mind immediately. There's the changing governmental landscape. It seems every time we turn around, there's something new coming out of CMS, which isn't a bad thing. We knew going into this that there was going to be iteration after iteration. So that's a common challenge, is just staying up to date on what's new. A great example of that, the ACO REACH program that just came out from CMS. And so being educated about that, knowing the ins and outs of that, where that came from, how that relates to the DCE model, why that's a good thing and not a bad thing. So that's one challenge. Another common challenge is finding local solutions for social determinants of health problems. And that just requires research. And it is very much determinant on specific geographical areas around the country. And now some of them are very similar, where you have maybe food deserts, or you have situations where people don't have rides. And all these things, there are solutions for them, but it's just a matter of doing the research in order to get there. Third challenge that comes to mind is developing usable digital tools for the members to engage and to actually take advantage of and manage their health. So this could take the form of telehealth services that they can call in and talk to their physician, and particularly in behavioral health or mental health.
How is COVID, outside of pushing some of these virtual tools, has there been any pros or cons or any contrast that's been created as a result of this change in healthcare?
Yeah, to your point, we were pushed into adopting telehealth maybe a little sooner than the market was ready for, but that's not a bad thing because the technology is there and the desire was there on many parts. The willingness, mainly because of the problems of implementation and the risk that maybe it wouldn't be as effective as people thought or hoped. However, in practical use, out of necessity, we found that it works. It is not something that is going to take the place of seeing your physician. It is purely a triage methodology. If you have something little, you can see your doctor right away through telehealth, and they can tell you whether you need to come in right away or whether you can wait a little bit. So in that way, what it's doing is taking the burden off the entire system and allowing it to work more efficiently.
So let's talk about maybe some of the common success factors from small practice provider run to large hospitals? Is there any sort of commonalities in your conversations from the executive level across the board?
One of them is committed and coordinated provider relationships, and that's a big thing that we have found in successful ACOs. And obviously there's different kinds of groups that we could look at, but if we're just going to target ACOs, and CINs function very similarly, if you have committed and coordinated provider relationships that are all aligned with the same incentive, and that is to further the quadruple aim, that's going to make a huge difference as to whether the whole system runs successfully. Kind of dovetailed with that is the ACO leadership. The ACO leadership has to be focused on the high-level mission of the quadruple aim, of lowering the cost of care, better patient outcomes, higher quality of care, and also physician satisfaction and engagement. So I would encourage anyone who's looking to implement some of these things, the easiest way to do it is just stay educated. Just stay on top of what's going on. Go to conferences, listen to webinars, read articles. To kind of plug VBC Exhibit Hall a little bit, we have a vast archive of reference materials and articles, webinars that we're doing all the time. We're trying to stay in front of what's going on, so we can help you in that mission. A lot of these organizations don't necessarily even come from a healthcare background. They maybe excel in the financial world or in the banking world or in economics, but not necessarily in healthcare. And so understanding the ins and outs of the accountable care organization is vastly important. So what I would encourage someone to do is to do very basic level searches for what is an accountable care organization, an ACO. I would start with a definition. To start with a definition of accountable care, what it means, where it came from, a little history, research, and then just dive into topic after topic. The secret is you'll never know everything, right? No, none of us know everything. Part of what we're trying to do in our mission is to sift through all the noise and find the most relevant content, the things that are going to be the most meaningful, and then put them into our newsletter, which is a great resource of material, and then also into our library.
I really thank you for coming out and talking about your experiences and all of the help you've provided us. So,
well, thank you. I look forward to continuing to work together.
You got it. Thanks, Garrett.
All right. Thanks, Ryan.